the Advisory Review Roundtable. Each month we take a panel of guests and discuss an industry topic at length. My name is William Dyer, and in a moment I will introduce our guests. This month we're looking at the topic of health and social care and the role that technology can play and should play in tackling social isolation. Let me begin by introducing our panelists today. To my right I have...
Hi, I'm Helen. I'm a consultant at Socitm Advisory.
And to my left I have...
Kevin Taylor from West Suffolk Council. I'm Service Manager for ICT.
And in the corner we have...
Russ, Charlesworth, Director of Health and Social Care for Socitm Advisory.
Thank you very much. It seems like over the last few years there's been a growth in interest from central government and local authorities in combating social isolation. In October last year, the Prime Minister launched the government's first ever loneliness strategy, and we had the first ever Minister for Loneliness. Why has there been this growth in interest?
Yeah, I think you're right. I think there's been a real shift recently in how we see and act on loneliness in society and in government. I think loneliness now is recognised as a health issue along with smoking and obesity a lot more. And I think that is because there's such a direct correlation between loneliness and a number of significant health issues. So there's links between loneliness and increased risks of heart attacks, Alzheimer's disease, falls, lots of things. So obviously when, these aren't good for people and they also cost local authorities lots of money as well. So when social care budgets are under so much pressure, it obviously makes sense to combat social isolation. So that's why it's on everyone's radar, I think.
Yeah, and loneliness can be a killer as well.
Yeah, I think the numbers are really, I think a lot of people will be surprised by the scale of the problem. I think recently saw numbers are set up to 200,000 elderly people have not had a conversation with a friend or a relative in the last month. And again, a more striking one, up to a fifth of people in the UK are citing loneliness as one of the key problems.
So what kinds of care technology tools are available for reducing social isolation?
Well, there's a range of care technology that's becoming available in various shapes and sizes. Internet of Things has been kind of driving and promoting that. We're aware of a number of examples. Southend-on-Sea have been using a robot in order to deliver care directly in care homes called Pepper.
Oh, I've heard about this.
Japanese
Japanese
invention.
robot.
Yeah, and it's gained a lot of interest and a lot of newsworthiness around the country. I think a bigger scale than the likes of robots and Pepper is the pervasive use now of consumer electronics, Alexa and equivalents, and that is supporting independence and well-being. And there's lots of very practical examples of where Alexa is using alerts for keeping folks hydrated, reminding them to be hydrated. So very practical well-being things. Medications, so prompting around medication adherence, making sure folks are taking tablets, etc. But there's also the connectivity ability for Alexa, where it's connecting with family and friends, and that's where a lot of the growth in care technology is going to take place.
Kevin, so I've heard that in West Suffolk you've been focusing on addressing social isolation by giving people greater digital skills and greater confidence in using digital tools. Can you tell us just a little bit about the project you've been working on?
Sure. Our Connected Together project, which is funded by Innovate UK, is a partnership really between Suffolk County Council, West Suffolk Council, and University of Suffolk, plus other private sector partners, including a big technology partner, aimed at delivering support tools to support greater independence, which touches on some of the elements of loneliness, which makes people more comfortable about being at home, about connecting people out to the wider world. From a district perspective, we're bringing sort of expertise and knowledge around a social prescribing project that was very successful within that particular area. And tying that together with colleagues at adult social care within Suffolk County Council, trying to identify those that are at high risk of transitioning through the tiers of care, and just trying to slow that process down, because there are some real big numbers that can be saved through that slowness of care. People much prefer to be in their own home and to be connected with others. And some of our technology or some of our products are looking at sort of meeting that gap.
So what have you seen the impact of the project being so far?
Impact of the project has been very positive it's a fairly small pilot currently, but the impact has been very positive in terms of encouraging people to speak to other people, family members, friends, organisations such as social care, trying to sort of identify some early warning signals, I guess, from people transitioning from care to care.
Yeah.
And also with our sort of our families and communities team, building on their knowledge and expertise around community engagements and building communities of contacts for some of these people to rely on, such as cutting grass when they're ill, and there's a particular app that we're using called Trimm, which will facilitate that. It's a volunteer app. You tap into the app and decide what services would be of use for you to offer.
So you're finding that the technology is actually enabling more human connection, more human interaction for people who are receiving care at home?
It is enabling more. It's providing a service that wasn't there before. It's providing access to family and friends through a video screen. Given that these people are generally often very immobile, they have a range of different physical and mental challenges. So this provides almost a gateway into different services and different people and different support.
So obviously, this kind of technology can have a really positive impact on people who are feeling the effects of social isolation. Obviously, it's no real replacement for face-to-face contact and face-to-face care. How do you think local authorities can use this technology to sort of further enhance the amount of face-to-face care that they can get or that authorities can provide?
I see this as sort of the aspirin that you take when you've got that minor headache. It's that first stage of connectivity. That how am I feeling? I'm letting somebody know that I'm not feeling particularly well. It's about the reduction in loneliness, and we've discussed previously around the impact of loneliness on social care budgets and on people's well-being and health. And if we could do anything in that area to help, there are some significant benefits to be had, both from an end user perspective and also from the local authority, and for those that provide services in support of those people.
Yeah, so getting people to maybe reach out to a volunteer rather than calling 999 or using some other kind of emergency service.
Yeah, and ideally to do it more on the preventative side rather than the reactive side. So it's trying to identify when people are more likely to be feeling low or more likely to have a fall, and to provide that technology there to slow that process down, I guess.
Helen, how have you seen this technology used?
Yeah, I think Kevin's really right there. I think I think care technology is used best when it's used in tandem with people and supports the face-to-face delivery of care. So I think picks up a really important point around prevention. I think there's definitely an important role for care technology to help support prevention of deterioration of health and well-being. So as Russ mentioned earlier, there's loads of consumer electronics now that can really help to track and monitor people's health and well-being. So everything from watches that measure your heartbeat to apps that look at your eyeballs to see how hydrated or not you are. There's so much technology that can really help carers to keep an eye on patients.
Actually, an example I heard just a couple of days ago, it was a sensor that would check that people are using their kettle.
Yes,
so that they're drinking properly, they're hydrating correctly.
Yeah.
That's a really good point. But there's kind of challenges associated with that, and about if local authorities have got this new amount of data available to them that can indicate that people's health might be deteriorating. There's interesting questions around who then acts on that, who's got the responsibility to act on that, how should we act on that. So that's an interesting challenge.
I think the other interesting dimension that kind of triggers is that this is not just technology that's supporting the relationship, the traditional relationship between person requiring care and the care worker, but we're seeing other aspects in a place-based situation. The one example, I think, is the work that's happening in Liverpool, New Malden and Whitby, where you've got postal workers, part and parcel of their everyday delivery rounds, armed with their smartphones and prompted with some questions of chatting to people that they know that live alone, and recording those answers and making those answers available to a platform, both to the care community, but to also family and friends. So if they can see during that day kind of small issues that are cropping up, they can be acted on, and that's very informal network. So it's technology not replacing professional care, but enhancing that through place-based solutions.
That's a really interesting example. I wasn't aware of that. I mean, it's showing how technology can be used, not just by the end user, but also the caregiver and other people within the community.
Right.
So Kevin, carrying on from the project you discussed earlier, what's been your most significant lessons learned so far? What kind of advice would you give to other local authorities looking to undertake similar kind of projects to tackle social isolation?
I think one of the key pieces of learning is around provision of a person-centred device. It's very easy for us to just roll out a bit of technology that's connected, which has got a whole bunch of apps on it that could do everything and anything for that end user in any scenario, as an example. That was probably where we were first starting from. However, conversations with potential end users and testing the devices with simulators for arthritis, as an example, and for glaucoma, to try and make sure that interface worked in as many scenarios as possible, and to reduce that level of applications or that level of services on the device to a level that's tailored to that individual. So one individual might want a puzzle to help hand-to-eye coordination. Another one might prefer the WebEx Team app to connect with friends and relatives, or a mix and match of community-based applications. There's a really good application called Elefriends that people can connect to and share how they're feeling and combat those feelings of loneliness. So it's around devising the end solution, not as a sort of one-size-fits-all, but one that's centered on the individual at the end of the device, and making sure they're comfortable and they trust the device, and that they feel as though it's a polished quality piece of work.
So if I can just share my own 2 cents in this piece. So a charity that I volunteer for called Good Gym. I don't know if you've heard of this at all. Yeah, so they're set up in most of the London boroughs, and they've started to expand across the UK. But it was originally set up 10 years ago with the goal of tackling isolation amongst elderly people. So the idea behind it was that lots of people like running, but rather than you just going up for a run just for the sake of it, you would go for a run to an elderly person who perhaps doesn't see many people on a regular basis. So you'd run to them, you'd have a conversation, you'd have a cup of tea, maybe they'd be there for half an hour or an hour, and then you'd run back. So not only have you've gotten fit by doing your run, but you've also really helped out someone who perhaps wouldn't have someone to talk to on a regular basis. And so now it's expanded beyond just like the coaching is what that aspect of it was, and now they have group runs where on a weekly basis, maybe 10 or 20 runners will get together. You run to a community task. It might be helping out an allotment, it might be doing some painting at a community centre, and then you run back. And I know that this whole charity was set up on the basis of sort of tackling this growing challenge, and having been a part of it, it's been a really rewarding experience. I've gotten fitter, and I feel better about things in the community that I live in.
Just listening to you, Will, there is something about this fundamental design of places around tackling social isolation. We've been talking today about some of the ways of dealing with it and how technology supports that.
Yeah.
I was talking the other day about, and it's one of the universities, that part of their halls of residence campus is to include frail and elderly incorporation into that on the ground floor. It's a 3-floor building. The top 2 floors are students, and part and parcel of their responsibility, and they sign up to the responsibility, is they're team tagged to an individual. So when they, off lectures or they're talking about their everyday life and drinks and all the rest of it, they buddy up with an individual on the ground floor, and it's just some practical, sensible things like that. Keeping, and both ways, learning both ways. That's the sort of thing that we want to encourage in tandem with the technology rollout.
It sounds very similar to the Care and Share initiative. Initiative where a young student will live with an old person, and they will both. The young person might cook for the older person, and then they'll get significantly reduced accommodation, which could be perfect in London and Birmingham, where that accommodation is very, very expensive. But it's a very, very good model.
So my brother is going to be finally moving out of my parents' house, and that is one of the things he looked at. Moving in with an elderly person, because the rent is, significantly lower than you pay if you're renting a place by yourself.
You're fixing the loneliness problem as well.
Yeah, you're fixing 2 problems at once.
Yeah,
and there's an education layer on this too. You've probably seen the Channel 4 programme where we had elderly folks going into local schools and running reading and literature classes for 4 and 5-year-olds, enhancing the kind of the overall learning experience. And these are the different layers that I think need to be brought into play in tackling social isolation in the round. Technology's definitely got a role in that, but there's also these kind of place-based community initiatives that hopefully will reduce social isolation, on a permanent basis.
So Kevin, would you be able to add just the learning you've had so far as a district council, and what advice you might give to other district councils out there?
Absolutely. Key for us is that we are seen as an equal partner around a particularly interesting project. We deal with the same people, but in slightly different needs. Our focus is very much on community building and community engagement, whereas Suffolk County Council are the care needs. When they become customers of Suffolk County Council, they're already in the care system. If we can slow our process, we can use our skills and knowledge and expertise within a district level to slow that process down, or to make that handover much simpler, much easier. We're adding some real value there. Also, from a district council, we are seeing things from a slightly different perspective than from both our private sector partners who potentially are there to commercialise a product, and our Suffolk County Council partners who we know are absolutely up to their ears in day-to-day challenges. So we like to think we bring a sort of a wider perspective to the project, and it's a great collaboration piece between private and public sector. It's been a very interesting, very positive learning experience for all of us in terms of how we design that interface and what works, and why just sticking a bit of technology isn't the right answer. It's delivering the right technology at the right place, to the right time, at the right time to the right person. Yeah. So it's combining all of those pieces together to ensure that the product is fit for purpose from an end user perspective. And almost a secondary benefit is that Suffolk County Council or that a county council will hopefully reap some financial rewards as well. But the focus is always going to be on that end user and improving their health, their well-being, reducing that loneliness, and that potential slip into health, physical or mental problems.
Our sense, there's a lot of appetite to learn more about care technology and its practical applications and the sorts of projects that Suffolk are doing. The last few months, we were recently engaged by Essex to take a look at the care technology landscape to inform some of their decisions. Interesting part of our dialogue with them, they were very keen that the findings from that research was made publicly, so to help other local authorities, including districts, come to terms with what sort of investments they should make. So it looks at the kinds of care technology that's out there, classifies it. It looks at case studies, things that are working well, things that are working less well, and it looks at some of the commercial models that are possible to adapt. Long gone are the days where it's paying for a pendant around an elderly person's neck. This is much more now. That's gone way beyond that. That's kind of first generation care monitoring, telecare, etc. This is about much more joined up community solutions about raising health and well-being, because prevention is the big agenda, and this is not purely about cost savings. This is also about making a better quality of life.
Are there any publications that we can point people to?
Well, this I was referring to there. There's Socitm Advisory, Socitm Inform, literally just published a care technology landscape report. That would definitely be of interest to them, and that's available via our website.
Fantastic. So Russ, Kevin, Helen, thank you very much for your time today.
Thank you.